Following a serious auto accident, Joe Tucker suffered a severe concussion and injuries to his back and spine.
He seemed to do well from his skull fracture. The blood cleared up from behind his ear, and there didn't seem to be any residual problems from that. And so after about 3 weeks, we went ahead and discharged him from the hospital.
But after only a few days, Joe was suddenly beset by severe pressure in his head, a clear discharge from his nose, and a fierce pounding headache. Joe was losing cerebral spinal fluid, and he was losing it fast.
This is very dangerous because anytime fluid can leak out from around the brain, bacteria can go up that same hole and get up into the coverings around the brain and cause meningitis, or even form a brain abscess. If it's left untreated, it is a potentially fatal condition.
Head trauma isn't the only cause of CSF leaks. Physicians want to know if there is CSF leakage for the following reasons: post-op cranial surgery, ear and sinus surgery, spine surgery, and even spontaneous CSF leaks. CSF leaks can lead to increased risk of meningitis, which may lead to death. Furthermore, emergency room visits can extend into lengthy hospital stays and prolonged post-operative care for certain surgical procedures. All of these challenges add costs to the healthcare system, take time, and present serious liabilities for hospitals, and medical malpractice liabilities for doctors. The current gold standard to test for CSF in human fluids is the immunofixation electrophoresis beta-2 transferrin test. This test may take several days to a week to return the results. Other methods include MRI, CT scans, HD cysternography, and nuclear medicines, which are all expensive. Glucose tests and/or halo tests are not specific to CSF leaks and may prove unreliable. Physicians in an emergency or urgent situation need to know quickly and with certainty what is wrong with the patient. Then they can determine what the best course of treatment should be. Surely there must be a better solution. Now there is a device that provides clear, reliable results in minutes, not hours or days, and costs hundreds, not thousands of dollars: the CSF Test Beta-T. In this bench test of the CSF Test Beta-T, 90 microliters of plasma were added to one device and 90 microliters of saline to the other device. Only 280 nanoliters of CSF were placed in one of the test devices. As the samples ran, a single control line appeared, indicating a valid sample. The second line on the device indicated the presence of CSF. To see the advantages of the CSF Test Beta-T, here is a side-by-side comparison with the immunofixation electrophoresis beta-2 transferrin test. There are only a handful of labs in the country that conduct the immunofixation electrophoresis beta-2 transferrin test, so even overnight shipping from the physician or hospital adds a day for sending and a day returning the sample. Immunofixation electrophoresis beta-2 transferrin test is an expensive process, so the labs collect enough samples to make a full batch to test. In the time it takes to collect and package the samples for the immunofixation electrophoresis beta-2 transferrin test, the CSF Test Beta-T is complete with reliable results. Imagine the applications for the CSF Test Beta-T with 1.4 million traumatic head injuries in the U.S. per year. There are more than 1 million head and transsphenoidal surgeries in the U.S. per year, and more than 1.2 million spinal surgeries in the U.S. per year. In addition, there is a global market that can be met with this test. Even more opportunities will present themselves at the point of need. The goal of any medical procedure is to restore people to health and happiness as quickly and cost-effectively as possible. Detecting CSF leaks is the key to a quick diagnosis and recovery from head and oral maxillofacial trauma, ENT surgery, neurosurgery, spine surgery, or other pathologic cases of CSF leaks. The CSF Test Beta-T is the only rapid bedside test that is quick and cost-effective and reduces medical malpractice liabilities.